Hi guys, Sydney here in the AAFE Training Center. We have a lovely patient in the chair today. We are doing a simple neurotoxin treatment for her. I started by marking those lateral borders of her frontalis, and now I'm just marking my injection sites on that muscle. I want good, thorough coverage of the entire muscle. If I don't treat laterally enough, we could end up with a spocked brow, which is when those lateral muscle fibers still remain fairly active and the middle is relaxed. All of those dots on her frontalis are where I'm going to inject. It doesn't necessarily mean that I am injecting that many units of neurotoxin. I come up with a patient-specific dose that works for them. I did mark up the glabella and the crow's feet, which is the orbicularis oculi. You can see I have 4 dots on either side, and that's just what works for this patient. I'll inject a little bit of neurotoxin in each site. DAO are what give us that kind of downturned corners of the mouth, and then we are going to relax those to kind of prevent some of that pulling. And then radial lip lines I marked up. Here I am injecting the frontalis, so holding that skin taut, entering at a slight angle. These syringes that I'm using are ComfortTox syringes. They are incredible. 31 gauge, 8 millimeter, multi-beveled. They go in really nice and smooth, and they are really, really great. I love using them. They're generally fairly comfortable for the patient. You can see here, patient bleeding a little bit, nothing crazy, and I'm just moving right along, pushing a little bit of neurotoxin in each site. I'm moving on to glabella here, so Procera straight in, and then each corrugator has 2 injection sites, always injecting up and away, making sure that I'm in the belly of that muscle and not too deep, because that frontalis, that lowest portion of the frontalis, does run behind these corrugators, and we do not want to hit that area with this much neurotoxin. I'm supporting that orbital rim and making sure that I kind of hold a little bit of pressure there, just so I know that I'm not getting any product leaking into unintended muscles. Here I'm injecting orbicularis oculi, crow's feet, always injecting up and away, holding that skin taut as possible. Trying to avoid vessels. You can see here that I did hit a little bit of a vessel. No big deal. She's just going to have a bit of a bruise and it will go away. I know that this patient is fairly bruisey, so I was kind of expecting it. And now I'm going to move on to DAO. So I'm putting my finger on top of that muscle and feeling where it pulls. Superficial injection, and I'm injecting away just so I, don't hit an unintended muscle by accident. Of course, it can happen, but we do everything to avoid it. Radial lip lines, this patient is amazing, so she doesn't need numbing. I would definitely need numbing if I was getting this treatment done, but she's doing great. I'm kind of squeezing that tissue and injecting right in, kind of perpendicular to the tissue, and giving a little bit of tox. We do need to maintain competency of this muscle to eat, talk, anything we would do with our mouth. So we are just giving a little bit of neurotoxin, nothing crazy, to kind of help with those wrinkles that form. It is a sphincter muscle, so we want to treat all the way around. I'm then going to wipe these dots off. Patient did phenomenal. We are always wiping up and away. Patient knows her post-treatment instructions, and thanks for stopping by. We'll see you next time.